6 of the 9 deaths are tied to this extended care facility, where up to 50 staff members and residents have been showing symptoms. A big part of the problem is who's inside. Elderly people, many with underlying health conditions. In other words, those most vulnerable to COVID-19. The state is ramping up spending, setting up special housing to quarantine people, and warning more infections are expected.
So it's quite clear that we are dealing with cases of community transmission in the state of Washington. And so even if you do not think you're at risk of the virus, the steps you take to prepare will help everyone around you.
This high school shut down for intensive cleaning after a student tested positive for the virus. 4 others are in quarantine, but the school reopened today.
Lots of different things that have to be considered here. It's a big puzzle, and it's a lot of unanswered questions, but we're learning as we go.
The case worries officials because the infected student had no connection to any earlier cases. In other words, it was picked up randomly in the community. Advice from officials to stock up is leading to lineups.
Toiletries, canned foods, paper products, they're out of everything.
It was even worse on the weekend.
Absolutely unbelievable. The lines went from here clear down to the end of the store, and they were restricting people how to get in.
Hand sanitizer, disinfectants, and some cleaning products have all but disappeared from stores as people take precautions.
We have 3 kids, so if they get sick for any reason, just stay at home and quarantine.
In BC, officials say be careful, but there's no need to close the border.
Still believe it's very safe for us to travel back and forth across from Washington into Canada.
U.S. officials had warned to expect an outbreak and fatalities somewhere, and this is where it's hit. The first big test for the system. Greg Rasmussen, CBC News, Kirkland, Washington.